कोरोना वायरस भारत के लिए सबसे बड़ी चुनौती बनने वाला है।
There are more than 1.7 million cases of COVID-19 around the world.
As the coronavirus outbreak continues, two very contrasting statistics from different parts of the world.
215 deaths recorded in the UK.
Italy has reported the highest one-day death toll from coronavirus.
Financial capital Mumbai too has seen a plunge in the daily caseload. 1,021 fresh cases have been recorded in the last 24 hours.
Punjab is facing another peculiar problem on its own.
फिलहाल पूरी दुनिया में 95,000 से ज्यादा लोग इस वायरस से संक्रमित हैं।
हिंदुस्तान के हर नागरिक को बचाने के लिए घरों से बाहर निकलने पर पूरी तरह पाबंदी लगाई जा रही है।
Next 15 days, our movement will have to be severely limited.
Stay at home during this pandemic.
Countries around the world are implementing measures to slow the spread of the coronavirus, from national quarantine to school closures. More than a third of the planet's population is under some form of restriction. Large sporting events, schools and universities, museums, cultural centers, swimming pools, and spas have been shut down throughout the country. While public transportation and airports are still operating, only essential travel is allowed, and those who want to travel for valid work or family-related reasons need police permission. All stores except for grocery stores and pharmacies are closed. The World Health Organization, which has officially declared the outbreak a pandemic, has called on all countries to continue efforts that have been effective in limiting the number of cases and slowing the spread of the virus. The impact of COVID-19 has been huge, not just health-wise, but economically. During this unprecedented time, people have quickly adapted to a remote way of work and play through the use of technology. This shift has increased the use of video conferencing tools and other workplace applications, giving us some semblance of business as usual. With gyms and fitness centers closed, many people are unable to maintain their usual fitness routines. This has triggered a rise of at-home workouts, with people turning to online classes to keep fit. With all of us spending a lot more time at home, people have been adopting technology to help aid them wellness and self-care routines. Meditation and mindfulness apps have had a surge in downloads since the outbreak of coronavirus. With in-person social interactions out of the window, for now, people have been utilizing technology to socialize with their peers. The usage of video streaming, social media, grocery delivery and online education platforms spiked during February-April, when most of India's internet users stayed at home. Data from the research firm showed that usage of e-commerce sites such as Amazon.com, Snapdeal, Flipkart declined as most consumers shifted focus to online grocery retailers Big Biscuit, Mart and Fresh to home for essential purchases. Daily active user base across online streaming platforms such as Netflix and Amazon Prime Video shot up by 122% and 72% month-on-month, respectively, between February and April. Besides online streaming, the daily active base also jumped across video conferencing platforms including Skype, Hangouts, Zoom during the said period. Data showed that Zoom registered the highest increase of 185% in DOS, while Skype's DAO base surged 100% in the 3-month period. Arogya Setu app, India's main contact tracing technology, was launched on April 2 this year. The app was developed by the National Informatics Center under the Ministry of Electronics and Information Technology. According to Niti Aayog CEO Amitabh Kant, it has become the world's fastest app to reach 50 million downloads in just 13 days. Arogya Setu is designed to keep track of other app users that a person came in contact with. It then alerts app users if any of the contacts tests positive for COVID-19. As the world anxiously awaits a COVID-19 vaccine, immunization experts are still adhering to a 4-phase clinical trial process. But, unlike other vaccines, those in development for COVID-19 are moving at a fast pace. Preclinical research, like animal testing, is done before the first human clinical trials can even begin. In the third phase, the vaccine is given to thousands to test for efficacy and safety. After the vaccine is approved by the FDA, licensed, marketed and manufactured. Many vaccines undergo ongoing studies for their responses on immune-deficient populations.